Stop living like a junkie if you don't fancy a liver transplant. That is what experts at the Liver Summit being organized at Hotel Marriott had to say. At the Liver Summit being organized at Hotel JW Marriott, experts cautioned people against excessive consumption of alcohol, saying it was directly linked to liver disease. Another nemesis for the liver, experts say, is obesity. They said around 350 million people across the world suffer from hepatitis B and 200 million people suffer from hepatitis C.
350 million of hepatitis B positive subjects suffering from hepatitis B, 200 million hepatitis C patients. Liver disease generally worse when you are hepatitis B or C infected, and leading to an increased prevalence risk of developing primary liver cancer, which is the big killer in hepatitis B and C infection.
According to Roger Stanley Williams, HIV-positive patients also contribute significantly to the number of cases of liver disease detected in the country and abroad. Around 14 million such patients are afflicted by hepatitis B and C, he said.
Some 40 million in the world, of whom a significant percentage have co-infection with hepatitis B and C. And then I also talked about the added risk factors of alcohol. So you have alcohol, hepatitis B, hepatitis C, hepatitis D, and also HIV.
Dr. Roger Williams informed the gathering about new drugs for hepatitis B and C. According to him, these drugs don't become resistant for 4 to 5 years, giving doctors a good chance of suppressing the disease totally. Latest medical advances now enable liver transplants with a success rate of 90%.
The advantage of these two drugs over previous drugs is that the virus, that's hepatitis B, does not become resistant to these agents. So you can go on treating patients for 4, 5 or even 10 years.
About 50,000 people need liver transplants in India, but only 700 transplants are actually done. 1/5 of these are pediatric cases. The most common cause of liver disease among babies is the EHBA syndrome, which makes newborns prone to jaundice.
Pediatric liver transplant would be about 1/5 the total number in adults. In India, total figure which we need is about 50,000. We are doing in this country close to 700 transplants, out of which about 1/5 of them would be done for babies. In babies, I must add that the commonest indication is what is known as a EHBA, or extrahepatic biliary atresia, which is a birth defect.
In India, there are about 40 to 50 million chronic carriers of hepatitis B, and in Punjab, alcohol drives people to the hospital for a liver transplant. 40% of chronic liver diseases in Punjab can be attributed to alcohol, 36 to 38% to hepatitis B and C, and 20% to the accumulation of fatty acids. These statistics point to the pressing need for dietary and lifestyle changes.
We have a rough percentage, about 40% of all chronic liver diseases, which include cirrhosis, are because of alcohol, and about 38 or 36% of them would be having viral hepatitis B or C, whereas 20% of them would be because of non-alcoholic fatty liver disease. These are the approximate figures, basically.
Negative changes in the lifestyle have rendered a large part of the Indian population vulnerable to liver diseases. As such, a healthy lifestyle is the surest way of maintaining liver health. For Lalit Sharma and camera person Gurinder Singh, Shresi Thakur, Day and Night News, Chandigarh.